Coronavirus myths, scams and conspiracy theories that have gone viral. As fears about outbreak grow, so does the number of myths about the virus, and many are more dangerous than the disease itself. Here are the top 10 myths and scams coursing the web that you need to be aware of. Myth number 1. You should be wary of receiving packages from China. False. Despite what internet conspiracy theorists might suggest, it is safe to receive post from China. The World Health Organization has studied how long viruses survive on letters or packages and says those receiving mail from China are not at risk. Myth number 2. Cocaine can kill the coronavirus. False. The French Ministry of Health has been forced to scotch rumors that Bolivian marching powder can kill the virus after a series of false stories began circulating online. Red wine, Gauloises and a Gallic shrug are also thought to be ineffective. Myth number 3. Alcohol can kill the coronavirus. False. In a similar vein, booze will not prevent you catching the virus. According to official news agency, IRNA, 16 people in Iran died from methanol poisoning after drinking bootleg alcohol. Whether it's moonshine or the finest Merlot, your tipple of choice will not cure coronavirus. Myth number 4. Hand dryers kill the coronavirus. False. No, not even those made by James Dyson. Hand dryers are not effective in killing the coronavirus or any other known virus. To protect yourself, clean your hands frequently with an alcohol-based hand rub or wash them with soap and water. Once your hands are clean, you should dry them thoroughly by using paper towels or a warm air dryer. Myth number 5. Spraying alcohol and chlorine all over your body will kill the new coronavirus. False. Do. Spraying alcohol or chlorine all over your body will not help. You are not an American chicken. Spraying such substances can be harmful to clothes or mucous membranes, i.e. eyes, mouth, warns the WHO. Alcohol and chlorine can be useful to disinfect surfaces, but they need to be used under appropriate recommendations. Myth number 6. Drinking miracle mineral solution can kill the virus. False. Followers of the pro-Trump QAnon conspiracy theory have reportedly been encouraging others to combat the coronavirus by drinking a substance dubbed miracle mineral solution. The liquid contains bleach and has also been falsely promoted as a miracle cure for everything from autism to cancer and HIV. Don't fall for this scam. Myth number 7. Eating garlic will help prevent infection with the new coronavirus. False. Garlic may help ward off vampires, but it's useless against the coronavirus. It's a healthy food that may have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the new coronavirus, says the World Health Organization. Myth number 8. Coronavirus was leaked from a high-security lab in Wuhan and China is trying to cover it up. False. About as likely as the Salisbury Novichok attack of last year emanating from our own high-security laboratory at Porton Down, which is not more than a stone's throw from the historic city. In short, it's total nonsense, up there with wacko theories about 9/11, the Holocaust and the death of JFK. The coronavirus is just another zoonotic infection, a virus that jumped from animals to humans. The Spanish flu, HIV and Ebola are others. Myth number 9. Saline rinse and mouthwash can help prevent infection. False. The bathroom cupboard is not going to provide any more help in fighting coronavirus than the kitchen cupboard, unless it is to retrieve soap or hand sanitizer. Unfortunately, there is no evidence to suggest that regularly rinsing the nose with saline or gargling mouthwash will ward off COVID-19. Myth number 10. Covering up with DIY masks and protection is a good idea. False. Now we are deep in Alan Krumwieder territory. The web is awash with images of people wearing everything from face masks made from fruit to full face helmets forged from recycled water bottles. Elsewhere, sales of paper masks have gone through the roof. Do any of these preventive methods actually work? No. Water bottles and plastic bags worn over the head pose a potential suffocation risk. Even surgical masks are unlikely to help. They are designed to keep droplets in, not out, and have to be changed frequently. Myth number 11. All hand sanitizers can protect you from infection. False. In the case of hand sanitizers, not all are created equal. They are extremely useful when traveling or commuting, and because they don't require a constant trip to a sink, they are easier to make a habit of using frequently. But if your portable cleanser contains less than 60% alcohol, or, worse, none, it won't offer much protection at all. Expert advice at the FA and the World Health Organization states that hand sanitizers must contain at least 60% alcohol to be truly effective. Thanks for watching this video. Please like, share and subscribe.